Good morning or good afternoon. My name is Bola Adedeji from the Office of Clinical Site Oversight here at the Division of AIDS. And with me in the room, I have my colleagues from our Grants Management Program, Mary Kirker, Emily Lindy, and Donna Sullivan. And we want to thank you for participating in this second webinar focused on the CTUs and CRSs, especially on a holiday weekend for those of you here in the US. This webinar is identical to the one we had last week on Thursday, and it will focus primarily around the CTUs and CRSs. We also had one of these webinars with our network leadership groups about 2 weeks ago. As many of you know, we have been working on ways to help to improve both our oversight here at NIAID, as well as trying to reduce the burden, the financial burden on you at the CTUs and CRSs. And also in response to some of the feedback that we've received, we have come up with this pilot that we hope will be helpful. This is a very important initiative to us here at NIAID, and we look forward to working with you and also hearing from you. And Mary will go into specific details about this pilot and how it will be operationalized, and we'll be implementing this pilot starting in December 2018. We'll be recording this webinar and making it available for you all, and it will be posted on a website that we'll send to you when that's all done. So with that, I'll turn it over to Mary to give us details about this pilot. Thank you.
I just want to let everybody know there really are there are very few slides, and the majority of the slides are talking about the providing a slide or two about what the pilot's going to do, as well as reasons why we think it's important, and then some timelines. What we would like to do is use the majority of time to answer questions. We would prefer that the questions, you can type the questions whenever, but we aren't going to start answering the questions until we've gone through the slide set. I hope that's okay with everyone. So let's start with the first slide, which is actually outlining what Pilot 1 is. With Pilot 1, NIAID will provide PF salary support directly to the CTUs for all network PF activities. So in July, we will be working with the LOCs, or the LOCs will be working through their information on the amount of PF salary support that should be dispersed to the CTUs for the upcoming budget period, the budget period beginning December 1st. That we will be providing it to the CTUs, and the CTUs will be providing that PF salary support to the sites that are affiliated with that particular CTU. In August, that information that we will be receiving from the LOCs will be sent out in a letter to the CTUs, letting them know the amount of money that they will be receiving by network, by site, for this PF salary support. In addition, that Type 5 letter will include, as it always has, the core amount that will be going to the CTUs. In October, the CTUs will be sending to us the RPPRs. Those will be due October 1st because we will be awarding those in December. The salary support in that application, in the RPPR, they will have to be providing the budget for the PF salaries, along with the core budget, as well as all the other required documents for personnel that one would expect within an RPPR. Funding will be twice a year, at least twice a year. The first portion of the award for the PF salary support. Now, this is only for the PF salary support. The core will be provided for a year like it always is. But for the PF salary support, we will be providing it a portion in December, and then again, an additional portion in June. And generally, what we're expecting it's to be half in December and half in June. However, it's always difficult to say because it's sort of based on the availability of funds, the amount of funds that we get through next year's appropriation. We will be providing a term and condition on all the CTU awards, which will indicate the amount of PF salary support by CRS. However, we will not be restricting those funds, and we will not necessarily be providing that level of detail about whether or not the funds are coming from the ACTG or the HPTN or the any of the networks. Now let's go over sort of the reasons why we're doing it. As you remember from the numerous presentations we've had about pilots and Pilot 1, that there were certain goals we were trying to meet, and we believe this particular initiative, this particular pilot, should be able to meet most or many of those goals. The first goal is really to provide increased sort of the management, increase the, we have provided the responsibility to the CTUs and the CRS for quality protocol activities. Therefore, we believe that they need to have the support to be able to address particular issues that may arise within the CTU or CRS for the protocols they're participating in. In addition, the NIAID needs to be able to work directly with one particular organization to help manage the personnel and other funding issues that arise due to the protocol participation. And we feel that providing the salary support provides the oversight we need of the infrastructure that we have built for the protocols that are part of the network. In addition, we want to ensure that there's some level of flexibility. We are going to be providing the salary support using your standard grant authorities, and therefore, again, the salaries will not be restricted. There will no longer be, it will no longer be necessary to account for the PF salaries by network, because that's not the way we're providing the funds. And the CTUs will have flexibility to use the funds to support their all their DAID's clinical trial network activities. So it's, again, I think one of the most important parts of this is that we will not be restricting these funds. It will help reduce siloing because it's not coming from individual networks. The amount of money will be able to be used across the networks. The amount of money that we're providing will be able to be used across the networks. It will help the CRSs maintain well-trained staff, regardless of protocol delays or changes. It will provide a consistent support for personnel. So it will be handled, and the personnel needs will be looked at in a very global manner. It will be looked at what that CRS, that CTU or CRS needs to conduct all the clinical trials that they're currently involved in. It will hopefully help the CTUs. We expect it to help the CTUs and CRSs because they will have the information on the personnel that they will be receiving to start be able to plan and implement the different trials that they're involved in. And the requirements will be based on the requirements of the RPPR and not based on sort of the different way of receiving information that may be currently required from all the networks. We are hoping that this reduces the burden. We actually expect it to reduce the burden. The CRSs will not need to invoice each network separately for personnel. It will be done through the CTU. The networks will not have to manage contracts for personnel. They will be only doing it for the other remaining expenses. And there will be no requirement for the CTUs to enter separate subcontracts with the CRSs to support the PF salary that we're going to be providing. I think that's a very important understanding, is that we do not expect it to be an expansion of the aims or something completely different than the subcontracts they are currently under with each CTU. This is how we're expecting to see the information. We will be getting the information from, these are bogus numbers, but we'll be getting the information from the networks based on the protocols that that organization is involved with and the amount of money. It could be direct cost. You will always have to they will always have to calculate the F&A based on a direct cost amount, and we will be using the total cost figures and giving you the CTUs and the sites, the total cost figures. And this is the timeline. The timeline has changed. As you can see, part of the timeline change is that we are still sharing this information with our stakeholders. We will, this is the last seminar. We will have this, webinar. We will have this webinar online for you to go back to, or for people who have not participated in it yet, to see the slide set and hear some of the questions. We will be, we have informed the LOCs that they will be needing to provide us information. The deadline has changed. The deadline now is instead of the 25th of July, the deadline, as we have informed the LOCs, is the 10th of August. And the 15th of August, we will be getting the letters out to the CTUs, letting them know the amounts of money that they will be receiving, both for the core as well as this new PF salary. In October 1st, we will be receiving the RPPR from the CTUs that will include the PF salary plus the core. And we will be doing the first award. We will want to ensure we get the awards out as quickly as we possibly can. And we will be doing them for December 1st start date. We will, hoping and expecting that those will be awarded prior to December 1st. We will be asking LOCs for additional information on for the next award, because remember, we're only giving a portion in December. For the next award in June, we will be asking for the LOCs for updated information on sites and CTUs participation in their trials. And we will be providing the next amount of salary support in June. I'm going to leave this slide up, and I can go back to any other slides you would like to discuss, but I want to open this up for questions and comments. We are very interested in your comments. We would love to hear information from you about how we can make this a success, and any other issues or concerns or questions you might have on the actual pilot itself. So with that said, I'd like to open it up for questions.